All right, good day, everybody. I'm Dr. 𝗏𝗏 here at Dora Family Chiropractic, and we're talking today, at least you're on this page, about neck pain. So if you're watching this, I'm going to presume you're dealing with or struggling with neck pain of some sort. So I just want to discuss a little bit, just a couple minutes on what do we do here specifically to address these types of conditions. First thing we're going to do when anyone comes into our office, we always start with a consultation just to make sure you're in the right place and that we think that we can help you. If so, we'll continue with our exam. And part of that process, we're going to have you resting on a table so that we can evaluate your spine. We're looking at the bones, the discs, and the ligaments, which really make up your spinal column. And we want to find out, are there areas of restriction? Are there areas of taut and tender fibers? Do you have range of motion issues? So we're simply going to, very gently, 𝗏𝗏𝑝𝑎𝑡, we'll actually examine the whole spine, of course, as we look, looking for those areas of inflammation, any signs of damage or restriction. Another portion of the exam that we're going to be looking at is the neurology. So your spine in and of itself is your bones, discs, and ligaments, but obviously inside your spine is your central nervous system. Obviously from your brain and your skull, down through the spine, out through the nerves to all the parts of your body. So one of the ways we assess that is we look at, are there any functional leg length differences? Like you might hear that a lot, or from other chiropractors or therapists, if you've got a short leg. If you do have a short leg, what we're going to be looking for is, where is it coming from? In other words, do you have an actual short leg, or do you have stress in your nervous system causing one side of your body to contract, pulling your pelvis up and shortening your leg? Oftentimes, which is often overlooked or misunderstood, is that short leg is actually coming from stress right underneath the skull here. And there's a primary area called your craniocerebral junction, which we find most issues stem from, and below there tend to be compensated. So we'll do a series of neurologic tests to determine if that nerve stress is actually causing the short leg, and that gives us more clinical indications of what do we need to do in the next part of the exam. Another critical component of what we do here is paraspinal thermography. So we're actually going to use a very specialized instrument to measure the health of the nervous system as it exits the spine and out into the tissue, which will tell us, A, is there imbalance and stress coming from the structure of the spine, but we'll also use that on subsequent visits to make sure the spine and the nervous system is responding appropriately. The unit that we use is called Taichung thermography, specially made for assessing the nervous system around the spine, and it simply will roll up from the base of the neck to the top of the skull and give us a reading similar that you see on the screen here. And for example, you'd like to see all green dots, and you'll notice there's different colors, most notable the red at the top right, indicating that there's a great imbalance right compared to left. So that doesn't tell us exactly what's going on or what we need to address, but it tells us there's something going on that we need to further investigate. One of the final things we'll do in your examination, once we determine that we can help you and that we're going to find the root cause of your problem, is we're going to do some specialized imaging. What you see here is known as a cone beam CAT scan, or CBCT, similar to the one your dentist might use, but obviously we're not analyzing your teeth, we're going to be analyzing your spine. And the cone beam allows us to take every different angle and splice to see and find exactly where the problem is. What you'll see here is a 3D image. And we'll use, again, the slices to find out where the joints have misaligned, specific angles, and so forth, so we know precise and exactly how to correct the problem. We will often also do what's called a motion studies, look for damage in the disc or any ligament trauma or laxity causing instability. So these are all things we want to know to make sure we found the cause of the problem and we know exactly how to address it. Once we've determined from your exam findings, and more specifically the precise imaging that we take, we'll find out exactly the cause of the problem, precisely how the spine is misaligned, and once we know that, we make a very tailored adjustment based on your own misalignment and your unique anatomy, because everyone's different. So no two people will get the same adjustment. Based on the angles we find on your x-rays, we'll actually use a protractor to get our angles that we need. And the adjustment does not involve any twisting or cracking. So if you're looking for that, you might be a little disappointed. But what this does do is it finds the exact cause of the problem and aligns it perfectly, very gently. The way this adjustment works, this is called the Blair upper cervical technique. The headpiece will cock up, and based again on your particular finding, we'll know right where to contact. It's quite gentle, So it might be something like this with a very quick and shallow thrust where the headpiece just drops down. So once the headpiece drops, the head stops, but the bone will just gently move into its correct position. And the cool thing is, once you have that done, you actually get to take a 10-minute nap, power nap, to make sure that it all sets in place in your adjustment holes. The other type of adjusting we do is called torque release technique. So let's explain that. If we're doing our job right, your upper cervical alignment should hold for a long time. But that doesn't necessarily mean there's not going to be subsequent stress or imbalance in the rest of the spine. So we use this instrument. It's called an integrator. It moves in 3 directions at 1/10,000th of a second, fires, recoils, and torques. So the simplest analogy would be it's like rebooting the computer. Because if you've got misalignment, that misalignment is going to come from muscles contracting abnormally, pulling your spine out of alignment. And muscles don't contract abnormally unless there's an aberration in the brain and nerves telling it to do so. So once we get the nervous system to balance, your muscles balance, and then your spine will balance itself out. That is the gist of the torque release. Again, very gentle. And we use a neurologic and reflex test to find out where we need to adjust. And it's extremely precise. So we're not just going up and down and cracking and popping, but we are clearing out that neurology so your spine balances. The last thing we would do, depending again on your specific case and what your symptoms are and what your spine presents like on film and posture, is we're going to formulate and create a tailored exercise and rehab program for you to do at home. Nothing too intense, nothing that takes too long, but things that are very specific to help you get better results faster and that you have long-lasting correction. So we look forward to answering any questions you might have. Feel free to call our office at any time. Thanks again.